In this very short voiceover, we're going to talk about acute arterial ischemic disorders, including arterial occlusions, Thromboangitis Obliterans, or also known as Buerger's disease, and much easier to say, and Raynaud's phenomenon. So acute arterial ischemic disorders are a sudden interruption of arterial blood supply to the tissue, to an organ, or an extremity that usually ends in tissue death.
Your Hoffman textbook has little to no information on Buerger's disease and Raynaud's phenomenon. Therefore, when you get to those slides, I have used an alternative textbook to support the evidence in those slides, and you can consider those slides your reference point for these topics.
An acute arterial occlusion is caused when a thrombus is formed in the heart and then travels throughout the body. And when it travels, we know it's called an embolus. It then gets lodged somewhere in the vasculature, blocking any further blood flow or perfusion of oxygen to the point beyond the blockage. And that's when tissue death, organ death, can occur. It can be caused by several problems, such as infective endocarditis or mitral valve disease or heart valves. It can be caused by AFib, and we talked a little bit about that in stroke, and it can also be caused by cardiomyopathies. So when there is this acute ischemic event, we can assess it by using the 5 Ps. Now the 5 Ps are described in your text, and one of them, by the thermometer, has a little bit of a different name in this picture than in the text. So in the picture we call it polar, and in the text they call it poikilothermia. I don't know about you, but I think polar is an easier word to say, so let's go with that. But what it means is it's addressing the adaptation of a client's limb to temperature in the environment. So the 6 Ps are pallor. So if we're looking at assessment findings, we might find an extremity which is beyond the occlusion to be pale. Obviously no blood flow is getting there. It may cause your client pain. There will definitely be pulselessness to that distal extremity, probably a hand or a foot. There may be paralysis, or there may be paresthesia, which is numbness and tingling. And then the 6th issue, of course, is that when exposed to the environment, and usually cold, there would be a difference in color and sensation as well. Without intervention, an acute arterial occlusion will most likely result in tissue necrosis, possibly also gangrene in just a few short hours. So surgically they may remove the embolus. It's called a surgical embolectomy. It can be treated with TPA to bust the embolus, or heparin is also another means of treating this. So this is not an incredibly common vascular problem, but just a brief little summary on it here for you. Now the next vascular problem that is classified as an acute arterial ischemic disorder is called Buerger's disease. So this is the first disorder that we've talked about that is non-atherosclerotic. So it is not caused by a buildup of that plaque on the vessel wall. It's called an immune vasculitis. So what it is it's an inflammatory disease. It does involve thrombus formation in those smaller arteries in the hands and the feet. It looks like peripheral arterial disease or insufficiency, and we would make the same assessments of distal peripheral perfusion, and but it is different. It's an autoimmune and an inflammatory process. It too results in tissue death and may lead to gangrene and often leads to amputation. It is not a common disorder as well. Usually affects men younger than the age of 40. And usually the cause is traced back to either cigarette smoking, chewing tobacco or marijuana. The only way to stop the damage done to tissue by Buerger's disease, to stop the thrombus formation in those smaller arteries, is to stop smoking. There really isn't anything definitive to diagnose it, other than the obvious, the symptoms. There isn't a cure for it, other than encouraging those with it to stop smoking. Some medications have been used, not with great effect. Sometimes the nerves have been cut. That's called a surgical sympathectomy, and that's really palliative to control the pain. But very often this results in amputation. So in the picture on the bottom, the lower picture, is evidence of some necrotic tissue from Buerger's disease. And in the little cartoon in the upper right corner, there is a short video embedded there. So you can click on that and open the hyperlink, and it's called Brandon's Story. And it's a young man who is a double amputee as a result of Buerger's disease. And he talks about his addiction to smoking. So you might want to take a peek at that. Raynaud's phenomenon occurs when there is vasoconstriction of the small, tiny arteries on the tips of the fingers and toes. It is also sometimes seen on the ears and on the nose. It can be seen on its own. It's called episodic, so it isn't there all the time. It kind of comes and goes. So we can see it on its own, or it may be secondary to a connective tissue disorder or an autoimmune disease like rheumatoid arthritis or scleroderma. Clinical manifestations are that when the episode does occur, the color changes on the tips of the fingers or the toes, and it will go from a pallor, and that's when the real vasoconstriction is occurring and the oxygen isn't getting to the distal extremities. Coldness and numbness also occur at this time, and so it looks white. And then following that is a change to a blue or a cyanotic color. And at this point, there begins to be throbbing, aching pain as deoxygenated blood is pooling in the distal extremities. And then the last stage of this is signified by a red color, and that involves some swelling, and the blood comes rushing back, and this can also be very painful. Now this whole process, this whole episode usually only lasts for a few minutes, although in some extreme cases it may last for an hour or two. I put the picture of the flag there. That's actually the Russian flag, just to help you to remember the color changes and the steps in these episodes and how it goes. So it's seen primarily in young women, which is the opposite of Buergers. We see it more in cold climates, and it is triggered by emotion and sensitivity to cold. The nursing interventions for a client with Raynauds phenomenon is really focused on client teaching and prevention of these episodes. So things like stress management are really important because that's a trigger for an episode. Also, if clients can learn what the precipitating events are and work to prevent them. So it may be different for each person what brings on their episode, so they need to learn that. So for many people, it's the cold. So we can teach them to wear gloves in the colder weather, and that may avoid an episode. For some, it may be emotions, and so we can work with them on coping and stress management. Caffeine and tobacco use are also other precipitating factors that can be modified to prevent these events. In more severe cases, calcium channel blockers have been used, such as nifedipine or Procardia, which is on your objectives page, and we know that calcium channel blockers work to relax the sympathetic nervous system, and so sometimes that can be used. There may also be a surgical sympathectomy done as well to interrupt the nerves if this is a real severe case. But generally cases aren't severe, certainly not as colorful as the pictures that I provided for you, but those you can see how the fingers will move through the phases by color. So this ends this very short voiceover on acute arterial ischemic disorders.